So today I want to talk about trauma. And I want to talk about what trauma actually does to a client, before I ever try to delve into how do we address it in therapy. So the thing that has to be remembered about trauma is that it's not a solely psychological thing. Trauma is often expressed in the body as a physiological change. According to some research, it even changes how genes are expressed in our kind of physiology. So like it can alter fundamentally how our body works. Now, one of the big things about trauma is that trauma doesn't have to be a major thing. It can be a lot of little things. It can be experiencing chronic stress, chronic levels of increased stress over long periods of time can result in traumatic injury, essentially. So when we're talking about trauma, what we're usually talking about is we're talking about something that really can't be expressed properly. Now, Bessel van der Kolk in The Body Keeps the Score talks about putting kind of patients with PTSD into MRI machines and studying their brains and that kind of thing. And he was able to demonstrate that there is a part of the speech center of the brain doesn't light up while people are actually experiencing or re-experiencing trauma, which basically means they can't actually talk about it. Now, a lot of the time, they can talk about the facts of it, so they can tell you what happened, but they can't really tell you what it was like when it happened. And that's very, very frightening. So fundamentally what happens is this event occurs, or this series of events occurs, which results in the inability of someone to actually create a meaning from it. It doesn't have any meaning for them, and it can't be, shall we say, explained or symbolized simply. And that's one of the things that makes trauma so difficult to actually treat, is that we can't just get a client to talk about what happened. That's not how it works. We have to help our clients to make meaning from what happened.